chorus on the ground. There are doctors, there are health professionals, from any profession. People are standing in solidarity and support. Supreme Court has taken suo motu cognizance of the Kolkata rape and horror case. A 3-judge bench headed by CJI D.Y. Chandrachud will also hear the matter on Tuesday. But this comes also in the backdrop of thousands who are already on the streets, specifically doctors. Delhi, Chandigarh, Pune, in Bengaluru and other cities as well. Because remember that while everyone can connect, as a woman or as an Indian citizen, to what happened and stands in support, but for those who are associated with the medical professional, that this hits closer home. The hospitals are supposed to be the safest space, and a 31-year-old trainee doctor killed like this in a brutal manner raises a lot of questions. And therefore, over 70 Padma awardee doctors have written to Prime Minister Modi demanding action against the heinous rape and crime. The doctors have also demanded a separate law to deal with violence against the health workers. And all of this will be, remember, while there are other protests that are also on the ground. And with 70 doctors who have signed on this letter, 2 reputed doctors are joining me right now in this morning telecast, and I want to appreciate both of them for taking out the time. Dr. Mohsin Wali, reputed doctor, he's in fact served presidents as well, cardio-physician, international repute. Thank you for joining us, Dr. Wali. And also Dr. Sanjeev Bagai, renowned pediatrician who understands this, not only the profession, but in many ways has spoken up throughout every time we've needed him with his expertise on different issues. So I want to first bring in Dr. Sanjeev Bagai on this. Dr. Bagai, what is the reason, do you think, that doctors over 70 across the country have decided to go ahead and be a part of this petition? What is the demand?
Good morning. I think this has been something which has shaken the conscience of the nation. Not only the family has lost a daughter in Calcutta, India has lost a daughter. And more what we have witnessed here in Calcutta. There have been serious lapses, be it in the hospital level, administrative level, the postmortem, the cover-up perhaps with political patronage and so on. So 71 of us put together thoughts and yesterday have written a letter to the Prime Minister mentioning 5 key points. Basically, it is to highlight stricter enforcement of the existing laws, harsher and time-bound punishments to be meted out to such crimes, enhanced safety measures, especially in the hospitals and nursing homes, enactment and implementation of specific law to protect healthcare workers, and whenever possible, the harshest punishment for violence against healthcare workers. So overall, we are looking at a safer environment to work in. Young doctors, especially women who are doing late night duties, continuous 24, 36 hours duties or longer, cannot work under a pretext of fear or anxiety that they're going to get hit, assaulted, or indeed raped and murdered. I think very clearly we need to protect our medical professionals, especially at workplace. This is something which we can't allow this young life to go in vain. Let this be a case example that India wakes up, the entire machinery wakes up to give a safer environment at workplace and to honor and respect doctors, but mainly to look after the women doctors, women nurses at workplace. Over to you.
Thank you, Dr. Bagai. Stay on with me. Dr. Mohsin Wali, now there have been incidents of violence, angry patients or their relatives who are known to be targeting or charging at doctors. There are different situations, but this one, the Kolkata case, takes another dimension. Why do you think that doctors who have received the highest civilian honours of the country have got together this time to write to the Prime Minister Modi, and what are you expecting?
No, we are already part of this mission because doctors and nurses, especially female doctors, have been a soft target always.
Yes.
This is a heinous crime which has happened, and the way this is being dealt with has some not only criminal overtones but political overtones. So we have to join together, sit together, and think home to request. Prime Minister is our guardian. So we have gone to our guardian to intervene in this matter, and we hope positivity. And then I am part of another mission in which Medscape today is doing this for a long time, and we are fighting for rights of medical community, whether it is Ayurvedic, allopathic, homeopathic, or nurses, both males and females, working all over the country. And we holistically want a law to be just tabled, which is already been worked out and is pending. And since 2019, this is pending, and this has to be tabled. And we are very hopeful that our sincere request, and as my colleague Dr. Bagai has said, that we thought in view of this crime, we should join hand together and should request to our guardian of the country that these cases uh, are happening continuously, and this is one of the heinous case which has happened. And no more such cases should happen, because doctors are being discouraged to join the profession. And that is one reason we should come forward, that the quality people should join medical profession. And then, since our doctors are already the best in the world, we should not lose this quality
Very important.
doctors. Yes, and that is why, to encourage our younger generation, our days were very good. People respected more, but now the doctors are getting soft, being converted into soft targets.
That's a
And the
very
working conditions.
important point, Dr. Wali, that you're making, that,
Yeah.
doctors have always received a certain kind of respect. They still do. But there are incidents of violence that are also being reported. Please stay on with me, because Dr. Bagai, at this point, remember, do you think it's also has to go beyond this incident? There are allegations, and I say allegations right now, it's not been proven, that there has to be a cleanup within the fraternity as well. Are there charges of corruption? Are there charges of any sort of transfers that are taking place? All of this will have to be looked at, so the young doctors who are joining in can feel free, independent and strong, that they are coming into a fraternity where they have the backing of everyone who believes in their merit.
Absolutely. There have been series of allegations against this hospital, not only now, but even in the past. And I think the medical administration there, be it the clinical or the non-clinical, just have to undergo a strict clean over. If the medical administration there cannot look after its own staff, it doesn't argue well for the medical professionals at all. We need safety norms, we need CCTV cameras, we need proper restrooms, we need duty call rooms, proper food allocated areas. Overall, we need a safer environment for young residents to work in. As it is, they work very long hours, they are under stress. We treat patients in critical needs. We see life and death at every second of our lives in the hospital, long 24, 36 hours. Let me tell you, there is no other profession which is more mentally, physically, emotionally challenging than medicine. Now, if we can't keep our young doctors safe there, then which way are we going? The hospital administration has grossly failed to say that it was a suicide and then do a turnover like a turtle. Then
Family
not to
also
allow the
maintaining
parents to see
why
the
was this
daughter.
being passed off as a suicide, should have been dealt immediately right then with in a better scenario. Dr. Wali, my final question to you is, right now, if the top bureaucrats, ministers, leaders are listening to you, and because you've served presidents as well, you understand that it is important to reach out to the top leadership. What kind of changes do you think must happen from here, with a hope that perhaps this will be the last that we hear of violence, or worse, rape and murder of anyone, but of course of health professionals and medical fraternities?
Simple but difficult. One is, we have to reform the society, our young children to behave properly and to learn the good sanskars which we used to have from our seniors and from our elders. The government side needs to be making a law much stricter than it is present. We have laws, but
Yes.
there is no stricter laws. You know, there are countries where punishment of rape is beheading. Rapes don't take place ordinarily like this. But this is not a case of rape. This is rape beyond rape. Murder, rape, murder. This is like that. And the sequence will come on inquiry. I'm not predicting the sequence, but this is a more heinous and more. It is to hide something bigger that has been converted into this crime, and this is a misleading to the public type of crime, and there are more hidden things which will come out. So this is pointer that we should have effective laws. I would use the word effective and stricter, and that is our demand for a long time. And we are very respectable way we are asking for it. We have not done anything beyond indiscipline. So we, in a very sober way, have written this letter, which has been taken up by you people very seriously. And the message the request through
Yes.
this letter is very simple, that already existing bill which is there for the safety of the medical profession should be tabled soon in the parliament.
This is very important because as doctors, as male doctors, as those who've been in the industry for decades now, to be leading with this initiative, and I hope that the top leadership, those who are as policymakers, can bring a change so that doctors who deal with saving our life can do it without any fear or favor. I appreciate you joining us, Dr. Mohsin, Wali and Dr. Sanjeev Bagai, for your views, and we will continue to put out the content of this letter, this petition, and with a hope that our doctors, our health professionals, without corruption, without fear, can work and ensure to save our life. Remember, as they had said, Indian doctors are considered to be one of the best and finest across the world, and there's a reason for it.